And it's my pleasure to invite the first speaker of this session, Leena Soininen, Chief Medical Officer DigiFinland, on stage. She brings a national perspective on digital health transformation and data-driven healthcare. She has extensive experience in implementing Finland's national digital health policy, including scaling innovations across regional health systems and ensuring clinical impact through digitalization. Before we start, I'd like to point out that please reserve your questions to the end of panel discussion, which will follow after the presentations. And with these words, welcome once more, and Leena, please, the stage is yours.
Thank you very much, Taneli, and thank you all for inviting me here. It's been a great pleasure to take part of this event and hear all the great talks here. I'm talking about promoting these innovations in public sector, mostly the very troublesome sector when we're talking about innovations. I have to say that I'm giving this talk from the clinical background, but I'm also board member of Health Tech Finland, so I have some involvement in the company, medtech companies also. And as stated here before, Finland is a small country. Our population is aging faster than in any other European country. We've been through huge cost cuts and laybacks in our well-being service counties. So we are running out of money and we're running out of personnel. But we still rank among the global leaders in digital capabilities. And of course, we're the happiest country in the world, which can be a friend or foe, but let's keep it as a friend. I think this is the most important slide in my presentation. And when we innovate, we have to remember what we are innovating for. What's the purpose of healthcare? The purpose of healthcare is not to invent technologies. The purpose of healthcare, it's not to take care of the country's economy, but the purpose of healthcare is to take care of the patient. The patient is always the first thing, and we always have to serve the patient. And what do we doctors value? Mostly, we value which is best for our patients, and this is what we have thought, that it must be evidence-based treatments for real and relevant clinical problems. That's the basis for innovation in healthcare. And of course, safety, do not harm, and safety is a very core principle in our work. Ethics, and of course, smooth work processes to enable all those things. But patient always comes first. And the question is, can public sector boost innovation? There are some things in public sector that are favoring innovations in public sector, and then there are some things that are maybe not so encouraging in innovations. There are a lot of data in the public sector, a lot of people working, a healthcare professional working in public sector, and public sector has tight connections to university and other academia. But there's often, at least in Finland, there's this culture not invented here. And there's huge workload at the moment, no time to innovate, no monetary incentives. And maybe the macroeconomic, which is GDP in Finland and the economic well-being of Finland, it's not the core task in the well-being service counties. But still, that matters to all of us. But I think where there's will, there's always a way. If we want to do that, we can do that. We have the common goal. We want good for the economy. We want good for the companies. We want do good science. And we should consider this as teamwork. We have all our own task to do, and play in the same team and play for the same goal. And there's enough work for all of us. We don't have to think that we're stealing each other's work, but we are all needed. And I will show you 3 living proofs that there can be innovation in public sector. First of all, the Finnish AI framework established 2 years ago. Ministry of Social Affairs and Health ordered the AI report 2 years ago, and DigiFinland has been part of producing these reports. And in June 2024, the social healthcare AI ecosystem was founded, and I think that's one of the best things that has happened in the national level. And this AI framework has launched AI pilots, funded AI pilots in the well-being service counties. And one more thing, it has established a social healthcare AI ecosystem, which is a huge ecosystem at the moment, over 250 organizations taking part of it. And this slide is a bit busy, but it shows those 10 pilots that are ongoing in the well-being service counties. So there are public sector, the healthcare, there are companies, and there are universities taking part of these pilots. So they're showing that things can be done together. Another example, which is a new one, established last spring, Digital Health Finland, and this aims for international growth of Finnish health tech. And it has a central office, which is run by the ministry, University of Oulu, DigiFinland, Business Finland, and Health Tech Finland. And it's a triangle where there's businesses, academia, and the well-being service counties and other entities that are taking care of patients. And these are the core focus at the moment, but these are evolving things, so we're working on them right now, but maybe after a year, the core focus can be something else. And digital treatment pilot is just started, and Finland is trying to test that if this digital treatment, can it be done in Finland, and the pilot aims that is this concept working in Finland. But it benefits the healthcare workers and the patients, these pilots, because these evidence-based digital treatments and self-care are in use free of charge. And it collects data so that based on this data, the decisions can be made that is this a concept for Finland or not. And it benefits the companies. 10 participating companies can validate their solutions and support for international expansion. And the centralized distribution model is also tested in this pilot. So this is pilot. We don't know yet if it's work, but after this pilot, maybe after 1 year, we know, is this good for Finland or not? And I really, really hope as many doctors and patients and organizations take part of this pilot. And I will conclude in this slide. My take-home message, there's really much to do. There's work for us, and this is teamwork. Let's work together. We all are needed. It's good for our patients, good for healthcare systems, science, and economy. And evidence show that this can be done. And those pictures are one of my favorite pictures taken from the Stanford Innovation Lab. So thank you very much.
So thank you, Leena. So